So basically, I'm just going to talk a little bit about what the options are once you qualify as a newly qualified GP. So I think we all know that GPs occupy a very pivotal role in the NHS, have been and will always occupy a very pivotal role in the NHS. And I think if one has to be a GP, this is the best time to be a GP ever, because there are so many options and so many roles one can do, and it's so diverse. I'm going to come back to that in a minute. There in the GP general practice forward view, there is a lot of support and funding available at the moment from the government and from the Department of Health. So this is the best time to be a GP, in my opinion. So Essex, why work in Essex? We have all these reasons of why Essex is really good to work at, and I really believe in it. I'm sure some of you will agree. It has got excellent facilities. The schools in Essex are brilliant, and the population is so diverse, so you see more diverse pathology. And I think personally that Essex is one of the most innovative and forward in doing things and trying new pilot schemes, trying different GPs with special interests, etc. So I think Essex is the place to be at the moment. So there are lots of options available. I think 20 years ago, most GPs who qualified went into partnerships. But these days, there are lots of options available. There's obviously a balance between what you want to choose and with a work-life balance, as well as what your career choices are. People think that partnerships are no longer valuable, but I can say that partnerships are really valuable. Or obviously, if you've just qualified and you don't want to dive into a partnership, maybe salaried GP is a good option. Maybe you want to locum around for a bit and then find the right practice for you. Or once you locum around, you might experience that. You might know that this is not right for me, or this is not what I want to work, or with whom I want to work. You might want to choose a training practice. You might want to practice with a group practice where there are a lot of people for support, and each of them have different interests, because then you grow and you learn. So that's, I can say for myself, that after I qualified, I was sure that I wanted to work in a group practice, a big practice where I could learn from different people and also get the support. Because I understand when one is newly qualified or about to qualify, you do get cold feet. It's not easy. From one day when you're a trainee and the next day you're qualified and you're expected to know everything. Yeah, it is daunting, but believe me, if you work with people who are forward thinking, who are innovative, and I think a training practice is a really good practice place to start. So you might want to start as a salaried, but you know, these days no one expects you to work full-time as a salaried GP. You could be innovative and do different things, which I'm going to come to in a minute. Have any of you heard of retainers? Okay, so that is a scheme run by the RCGP and the deanery, where so if someone has been out of practice, or say they've been on maternity leave or sick leave or taken a career break, and you come back, the Royal College funds a retainer scheme whereby you can work 4 sessions a week as normal working day, and you work in a practice which will support you slightly in terms of, you know, you not like a trainee per se, but you can go to them for if you have any questions, and they get a little bit of funding for it as well to support you. So that might be a good way of kind of easing yourself in, especially after maternity leave or a long sickness. It's hard to come back because things are so dynamic, things change so quickly. So that might be a way of doing it as well. So you can only work 4 sessions a week in normal hours, but you can do things like, you can be an appraiser, you can do some out of hours. So that's just another option to think about. And when I say locums, that also includes being an out of hours doctor, because, you know, that's, although I don't recommend, and I heard the previous speakers also not recommending just being a GP in A&E all the time or doing out of hours all the time, because I strongly believe that when you're trainees, you do acquire so many skills and so much knowledge in these 3 years, which you don't realize probably. But being an out-of-hours doctor, you get de-skilled very gradually. So say if you think, okay, 5 years, I'm going to earn a lot of money, I don't want any responsibilities, fair dues, because you probably have a young family as well. But you don't realize that after 5 years, when you try to go back into salaried or partnerships, you're losing all those skills which you've acquired about chronic disease management, palliative care patients. So it is quite hard to go back into that after a break. So I think just doing locums where you don't really belong to a team, and how are you going to form your appraisals where significant events, complaints, what are you going to show? And that each of these things contribute to building up your portfolio. Also, obviously, it's traditionally and statistically proven that as an out-of-hours doctor, you do get more complaints than if you are in a team setting. So I think you do have to choose your options quite sensibly. Doesn't mean you can't do out-of-hours, but I would strongly say that being part of a team, even for part of the week, and then doing additional things is what I would recommend. Other options. So, obviously, we know that there's a shortage of GPs, and we want to keep the GPs in the area, and that's the aim for this fair. There are post-CCT fellowships being funded. Are you all aware of it? Okay, so they are being funded by the Health Education East of England. So there's something called post-CCT fellowships, which is like doing a ST4. So you get almost an extra year in training, and you acquire different skills as well. So you might want to do CCT, post-CCT fellowship in leadership. You might be inclined towards working in the CCG or being, a part of having a say in the CCG. Or you might want to do the fellowship in dermatology to become a GP with special interest in dermatology. We all know how effective and efficient our community dermatology services run by Dr. Buhari in Basildon. So you could do that. And this is being funded by the Health Education East of England. There's also another body, the CCG, for which I have the meeting next week, where the CCG, to keep the newly qualified GPs in the area, are also thinking of funding this post-CCT fellowship. I know 2 specialties have been granted funds, that is dermatology and respiratory, and we are in the process of trying to get more. So this will depend on what you guys want. So I think I spoke to a few of you, and these were the 2 most popular specialties. But say if you want something in rheumatology, we can always look at that. Or if you want to do a fellowship in or postgraduate certificate in education and training, we can look at that as well. So this is, I can tell you, this has never happened before. Once you're finished your training, there is no funding available. All the CPDs which we do as GPs, we have to organize ourselves and have to pay for ourselves. So this is, I think, an excellent opportunity. So you could still work in the post-CCT fellowship. You could still be a GP for 2 to 3 days, and then you could do the fellowship alongside, and the CCG or the Health Education East of England will fund it. So I think that is a big thing. So also, apart from the CCT fellowships, you might want to become involved in the CCG, become the CCG chair. That is a big position of responsibility. Or you might want to go into management. So at the moment, there is this potential merger happening between MSB, South End Basildon, and Mid Essex. So I know a couple of GPs who are on the board for that, and they are heavily into management. So if that's your inclination, that's another thing to do. And you don't have to do it full time. You can be a GP for 2 days, keep your skills on, and do part management. I know GPs who've done MBA as part of this management program as well. So it depends on what you are inclined to. You don't have to be a GP 5 days of the week. Leadership is the other buzzword these days in medical faculties. So you could do leadership courses, diplomas, and then go into management or go into CCGs. I mean, I think leadership skills will help even if you want to run a GP surgery as a partner. Yeah? Any questions so far? So I think one needs to start, I know being a trainee is not easy, you've got exams to do, portfolio to look after, assessments to do, but start thinking about what you want to do after you qualify. Because thinking of it after you finish qualifying, there's no harm in it, but if you forward think about it, you could take advantage of these post-CCT fellowships or other funding available. One could, there are so many education and training opportunities available these days. You could be a part of the faculty of Anglia-Ruskin University, you could teach there or go as a part-time lecturer or just be involved in the GP curriculum for that matter. You could, in your practice, if you are inclined towards teaching, then you could have medical students, you could have physician associates, again from Anglia-Ruskin. You could be a mentor for nurses. And that's really very gratifying as well, because then the nurses become prescribers and they become nurse practitioners and they can actually see minor illnesses. And I think that we have to work collaboratively, and that's the way forward. I think as GPs, we alone cannot see every patient who walks through the door. We've got to learn to delegate, and we've got to educate patients to be able to be willing to see nurses or a nurse practitioner or a physiotherapist. So have you heard in the news that now the next aim for the government is to get physiotherapists in each surgery so that musculoskeletal problems can be diverted to them. So we've got to work collaboratively. So I think mentoring nurses is another thing which one could start with, and then go on to medical students and physician associates and then become a GP trainer if you like. Of course, we know about GP trainers. One of our trainees has already done the GP training course, which is the PG cert. Stop sinking into your chair. So yeah, so if you are inclined towards training, then become a GP trainer. And once you're a GP trainer, you can be the out of hours clinical supervisor, you can be a nurse mentor, you can teach everyone once you're a GP trainer, because that's the hardest to get to. But then you can teach everyone who comes to your practice or outside. So that's another thing to think about. It is a diploma in healthcare, but we can get funding for you for that as well if you are inclined towards that. So the world is an oyster at the moment for GPs. You could be a GP for 2 to 3 days and then pursue your special interest and become highly skilled at that. So the commonest GP with special interest, I think the GP with special interest term is a little bit outdated now, but you could just have an interest in either dermatology. I know GPs in Billericay who have occupational health degree, and he does part-time occupational health, part-time GP, and it's amazing. Gynecology, you could do a colposcopy clinic. I know a GP who does a colposcopy clinic every week in the hospital and is a GP. You can be respiratory or rheumatology. MSK is another very hot GP with special interest. And of course, these days the buzzword is aesthetic medicine. So you could do a GP dermatology diploma and then go on to do some aesthetic medicine and do some work privately if you like. So there are so many options these days. Any questions? I think if you're interested, go and speak to someone, because there are definite ways of finding funding for it or finding ways of getting you on some courses. Okay, so a lot is advertised on the Royal College website, and then there is our Health Education East of England website as well. And then they can always contact us, as you know, we are representatives of the Health Education East of England locally. Yeah, absolutely. And if you're interested in particular courses, just, if you ask the question, there may be a yes, but if you don't ask the question, then you're not going to get it. And obviously, we want to keep GPs in the area, so CCG and us can work together and find something for you guys. Any questions? So I believe now all of you are going to work in Essex, yes? Good. Have we convinced you? There are lots of jobs in our end of Essex as well, so. Good. Brilliant. Thank you very much. Thank you.